The Africa Centers for Disease Control and Prevention has warned that Africa must brace for a second wave of COVID-19 infections. It has COVID-19 cases surge in Europe, the United States and other countries locally. The health minister has also raised concerns about the numbers over the past week. Joining us to discuss this further is WIT's Reproductive Health and HIV Institute Deputy Executive Director, Professor Francois Fenter. Good evening, Professor Fenter. One would think that you obviously need to first get through a first wave before you get to a second wave. When one looks at the level of infection across the continent, we haven't really had the peak that other continents have been facing. So can we say that we risk entering a second phase of the pandemic when some countries haven't really felt the impact of what a big peak would be like?
So I think what we had in South Africa is a massive initial wave and then a continual background infection rate, which we're experiencing at the moment. And we are seeing an increase in numbers at the moment. So it's very difficult to compare us to Europe or to Asia or any other parts of the world at the moment. So I think most of us accept that we are seeing a resurgence of infections. Whether we can call that a second wave is difficult for us to say. I think the bottom line message for the average South African is we need to be aware that something is happening here, that there is continued infections in the community, and that over the Christmas holiday period is not the time to take your eye off the road. We're still within a pandemic, and we still have the possibility of people being infected and spreading it around, and particularly over the holiday season where people are congregating.
And if we go beyond South Africa's borders to the rest of the continent, would you say the same applies?
It's very difficult to know what's happening on the rest of the continent. South Africa has pretty good data collection, especially around hospital admissions and deaths. The testing positivity rates, I think, are much more dubious. But I think that people need to understand is that when they say this country and that country is okay, we don't really know some of the testing strategies in those countries. And this disease, there's some work that's been done that showed that South Africa, in fact, the death rates here were every bit as bad as predicted and every bit as bad as in the worst affected places in the world. So this narrative that somehow we were better off than anywhere else, despite our youthful population, is actually relatively flawed. As I said, the message needs to be afraid, or not be afraid, but be aware of the fact that this is not over, that this thing is every bit as bad for elderly people, for diabetics, for hypertensives, and we need to be really careful this holiday season.
Professor Fenter, just to chat a little bit on some of the figures that you've been referencing there, at least in terms of comparing South Africa to, let's say, European countries. My understanding is that our death toll is much higher than what has been officially recorded, just as a result of the higher mortality rate. But comparatively, the expectation is that it is still much less than what was anticipated for the country.
So the modeling that actually, so there's still some debate, and it's important that South Africans also understand we're still picking up the pieces of this. Some of the mortality data is still coming through. It's also unclear how much of that is actually COVID and how much of that is the consequences of lockdown and the decimation of the TB, HIV vaccine and all the other services there. So this is just preliminary. All the data I've seen is that the death rate was pretty much what was predicted and is not much lower than the rest of the world. So, a lot of the modelers that I talk to are very sober people, very considered in terms of their approach, not very excitable, which is what I think you want in a health modeler, have kind of been saying it panned out the way we expected. So these figures are up for debate. There's certainly, I don't think anyone sensible is signing off on them just yet. But I certainly do not see anything here to say that we somehow weathered the storm well. There are a lot of people died in South Africa. One of the models I saw is that COVID-19 will be the commonest cause of death in South Africa for 2020, eclipsing TB, diabetes, and all these other things. So it does give people the sense of how bad this actually was. Whether it's as bad as predicted or worse or less bad, I think we'll be working that out over the next 6 months or so.
When you talk about the current testing and the positive results being dubious, what do you mean?
So, the testing strategy is incoherent. If you were going to have a strategy where we tested the same community at regular intervals, at the same time, trying to work out in that community what's happening in those communities, that would make sense. What we're seeing at the moment is the majority of the testing is happening in the private sector. In the public sector, we're not seeing a coherent strategy in terms of surveying communities. So the way I talk about it is like if you put a speed camera on the M1, and try to trap cars. And one day you set it from 4 to 5 a.m. and the next day you set it so you only caught red cars. And the day after that, you did it during rush hour. You're going to get completely different results in those three. And that's essentially the South African testing strategy is every other month there's a new strategy. So you're not testing the same people at the same levels at the same time. So it's very difficult to get a coherent number. So when people tell me, oh, so many people were positive, they can't tell me who was tested. Were they symptomatic? Weren't they? So the harsh stuff, which we can rely on, is hospital data and death, and particularly death data, which South Africa actually collects relatively well. The problem, as I said, is sometimes a bit of a lag in terms of the reporting of that death data. So I'm very cautious of interpreting. When people say we had an 8% increase in Western Cape infection rates last week, it means, it means next to nothing. You could have had a whole of private sector people very worried, going to test at the local pharmacies, and that could have given you the positivity rate. So I think the sensible thing is to be very careful around the testing rates and interpretations, and to look hard at the mortality data, because that we collect well.
Fair enough, because on the mortality rate, I think there's a general consensus among scientists like yourself that those are more reliable figures, especially with the benefit of hindsight. But as a measure for week on week, we know that government uses the weekly averages of these test results to then determine whether or not they get a sense of the virus moving, either increasing in the country or remaining stagnant or whatever the case might be. I'm assuming that there's still some role that testing plays and that these figures play.
No, to be quite honest with you, I think I know it seems difficult to understand why government would do this. Until government has a coherent strategy as to where it's going to put it in one place, then we'll be able to more accurately say. Every sensible scientist I work with looks at the testing numbers and just shrugs their shoulders and says we're pretty much wasting money looking at that. So, yeah, we know there's community transmission, but the reason we know that is that the hospital numbers are starting to creep up. There's been a few increases in the death rates, and we're seeing cases in the hospital all the time. So we know there's ongoing transmission at the moment. The numbers are way down on where they were at their peak in June, July, but that doesn't mean nothing's happening. So I'm not saying there's no infections. I'm just saying the testing numbers need to be interpreted with, as I said, most of my scientific friends just shrug their shoulders and say, where's the death data? Because that will tell us the reality.
All right. Professor Francois Fenter, he's the Deputy Executive Director at the WITS Reproductive Health and HIV Institute. Thank you so much for your time on News at Prime tonight.